Hi, welcome to my channel, Rohit Speaks. And in today's video, I'm going to cover a topic and I'm going to go briefly over what is basically stem cell therapy or what are stem cells if you were wondering what is it and how it works. So, to understand that, you need to understand, well, what are stem cells, first of all. So, if you look at so what it starts is that it starts at birth. So birth is, if you know, you are made up of cells, right? You start with a zygote where your egg and your sperm kind of fertilize together, and it forms this called as blastula. This stage is just bunch of cells together, and then they form these three layers called as ectoderm, mesoderm, and endoderm. So blastula has the cells which have the potential will basically form your organs, your muscles, and all of that. So the cells here, these are actually called as embryonic stem cells because it is formed from embryo. So embryonic stem cells. But these stem cells have the capacity to become anything. If it gets the right stuff, can become your muscle, it can become your organ, it can become your eye, it can become your skin, blood, whatever it is. It is at this stage where a certain cell can become anything. But in a normal, when you're going through fertilization, these cells have layers, they form these three layers, ectoderm, mesoderm, and endoderm. So endoderm basically forms is your the inner layers of your organs. Ectoderm forms your exoskeleton. Usually it is um, all your skin cells, all those stuff. And then mesoderm is what is basically forming your cardiac muscle, stomach, and all those stuff. So this is your normal programming in your adult or in normal human life. So it is at this stage where these cells technically becomes these three layers. These three layers then form all your system. So when you grow up and you become an adult, these cells are gone now. The cells which has the capacity to form these three layers, which can technically become anything, has gone now. Now it has become called as adult stem cells. So adult stem cells are basically there around your bone marrow, your muscles, your liver. These cells, or now we call it as adult stem cells, they have only capacity to become a sortum cell. So if you're looking at a mesenchymal cell in your muscle, if there is some muscle damage, small muscle damage, that cells can become your muscle and will replenish that, but it cannot do a extensive. That's why when you lose something, you cannot just form a new muscle or a new organ or all of that. That's why adult stem cells cannot do that, and you cannot regenerate basically everything because their capacity is lost after they are gone through this stage. Okay, once they have gone through this blastula into this stage, they have lost that capacity. So to put that in simple terms, embryonic stem cells can become is pluripotent. Pluripotent means it can form anything. Multipotent, so when you go through the three stages, form these kind of stem cells. Multipotent is basically, for example, when this embryonic becomes a mesenchymal, it can form all this stuff, but it cannot form any of these stuff. Hematopoietic will form your blood cells and all of that, but it cannot form your muscle. Neural will always form your neural stuff, but it cannot form muscle or your blood cells. But so that's embryonic stem cells. Okay. So now where does the stem cell therapy comes in? So what currently is going on is basically adult stem cells, which are from your skin or from your muscle or from your bone marrow, they are being reprogrammed to become something like this. So they are called as induced pluripotent stem cells. So basically, once they are reprogrammed, they can technically become anything. They can become a muscle, they can become a nerve agent, or it can become a blood cell. But the research is still going on. Okay, they cannot you just make something and put it in your body because there is immune reaction, it has to accept your body. There's a lot of other things going on, but in basic it is basically in basic or in simple terms it is these cells are being reprogrammed to become or mimic something called as embryonic stem cells, which can technically become anything. So you're kicking back your adult stem cells back to an embryonic stage where it can form any of these cells. Now where stem cell therapy has worked using, so simple example would be hair in hair regrowth. So they are using stem cells from your area where the hair growth is pretty okay. They take that stem cells and replant it in an area where it can be regrown. So that place where it has lost its capacity to grow some hairs, they are using stem cells from your actual body. They're not going back to embryo, but they can just use whatever is available and do it. But if you need something like extensive changes, like for example, your muscle, your heart has undergone myocardial infarction and there is some dead tissue in it, and you want to regrow some of part of it, you need to basically, or the research has to go back to this area and figure it out if we can put this back into the heart so it can actually patch that area and still start beating. And research is going on, and I believe in a couple of years you will have some breakthroughs in this kind of therapy. So stem cell therapy is that. It's basically bringing back this regenerative capacity of these cells and using that to treat whatever is gone. So here is another example, or simple terms, I'm explaining what is adult stem cells and embryonic stem cells. So adult stem cells are undifferentiated, but they can form only a certain type. Embryonic can go if you give them the right conditions. So you take those stem cells, embryonic stem cells, and put it in a culture where you're making sure that it becomes a muscle, it will become a muscle. And here I'm showing actually one of this, what I talked about, this reprogramming. So they have taken literally your blood cells, removed the PBMCs or peripheral blood mononuclear cells. You don't have to worry about it. It's just certain types that cell can form new blood cells. So they have taken that out and reprogrammed it into a cardiac cell. And you can see that in this video, it's actually beating. But again, this is just for research. It cannot be actually just put it into a human heart, because if you put that and if there's an immune reaction, it doesn't match, it will actually attack that heart as well and you will die. So we need to bring up something which doesn't invoke your immune reaction. That's one way. Other, which is considered as an unethical, is actually artificially inseminating an egg and coming to a stage of blastula, where you can extract this embryonic stem cells, where so you can put it in a petri dish and isolate these cells and then culture them into a viable pancreatic cell or a lung cell or whatever it is. But again, you're not putting it into a human, but you're actually using a human egg and a human sperm. So there has been a controversy on that. So it's some kind of an ethical issue. I don't know if we can work around it, but that's one way of doing it. But this somatic cells into induced pluripotent cells is another field which people are looking into it. So this field has potentials. It just requires a lot of research and to look into uh, potential for future development. And if you, I think Neil deGrasse Tyson has predicted that we will come to a stage where we can regrow our limbs and muscles and all of that. And I feel like this is where it will start and this is where it will begin. So stay tuned for that. But stem cells in certain area, it works at this stage, but requires more research in my opinion. So with that, I'll switch off this video and I'll see you on the next one. Bye for now.